actually see my slides. Are we there?
We're there too. It's working.
Perfect. So it is December, so I thought we have a little bit of just a little bit of a Christmas feel to it. But actually, what I want you to do for a moment now is close your eyes, and I want you to picture yourself on the 3rd of December 2030. So your self-drive clean fuel transportation pod has dropped you 3 kilometres away from where you need to be, and that's just so you get a little bit of time in to get some recommended daily exercise and some fresh air. Your co-worker bot, however, has been quite busy and has already prioritised your daily workload. And that's based on your strategic plan, your review of priorities and your learned behaviours that may, of course, be where it all starts to go to pot. Before you get to the door, you've used your smart wearables to make your tea. Not sure I fully approve of that, but you know, it can be done. So to get them to make your tea, open the blinds and switch your portable processing unit on. As you land on campus, you bump into the Chief Finance Officer, and he thanks you for organising your virtual coffee break session last week and saying it generated some great ideas on connection, human connection, very important. And he asked you to go into a team huddle the following month, and could you confirm the date? And you've knocked that straight into your speech-activated diary. So you arrive at work refreshed on this December day. You're looking forward to interacting with your colleagues. You're looking forward to reviewing a lessons learned, an appreciation event around just how much AI has transformed healthcare in the past 10 years, and what you think is going to happen between 2030 and 2040. And just consider what you need to put in place now to make the most of innovations of 2030. So you can open your eyes now. We'll go on to the next slide. So a lot of this stuff, these technologies that we associate with the fourth industrial revolution, and I've flagged a whole load of them in there, AI, machine learning, smart wearables, robotics, the Internet of Things, they all seem to have gone from 0 to 60 really fast without going through the usual sort of adoption curve. I'm not entirely sure that's actually true, but that's how we perceive it, the speed of which it has moved. And so we start to ask ourselves the question of, is this friend or foe? And we can see that AI is everywhere. It isn't a sector, it's everywhere. We can see and we can predict that in terms of roles, this is going to impact most on roles with a high percentage of high volume repetitive tasks. And we can see that there are huge opportunities for us in our sector around that. But of course, we have a choice. We have choices. Society has a choice and we have a choice as we lead these changes. And we can do this in ways that take the machine out of the human and really give us that gift of time. There is so much we do not get done through our work that with the gift of time we can extend our reach, and as knowledge brokers there's so much more we can do to contribute to high quality healthcare. So successful implementation is about the strategy. It's not whether the technologies themselves are benign, but about how we choose to deploy them and with what accountability they're deployed. So as knowledge breakers, we can see that we will be amongst a group where demand will shift to people who can be the bridge between capability and business need and what lies ahead. And I think the question for us as we sit here in December 2020 is what are we going to do collectively and individually to position ourselves as a specialist workforce ahead of this curve, able to understand it, able to help the people we support and serve and their organisations to understand it. And what does it mean for healthcare? Well, it's in the news daily. Clearly, this is just a quick run through a list, but some of which we've already referred to, but diagnostics, prediction, particularly when you get a combination of technologies. That's one of the things we saw in the Topol review, for which I was the review program manager, that you could see these things coming together in ways that we haven't anticipated. Already a lot of progress around medical imaging and interpretation. I'll show an example in just a moment. AI-powered applications and robotics for assisted living and long-term self-care, all already in place. And then when you start to think about how this may play out in our part of the turf, potential for AI-based chatbots, early experimentation going on around that, definitely work around accelerating the process of biomedical information, the processing of this as part of decision support. And I saw in the chat people talking about screening and sifting and searching results. Absolutely. Work that's already underway, already being piloted over several years now. Within the NHS, look out for the work of the NHS X AI Lab to support the system to trial innovative ideas. This lab has been set up, multidisciplinary team of people coming together. The Skunk Works team are going to support health and care communities to take this stuff through from somebody's great bright idea, proof of concept, through to what kind of minimum viable products would you need in the NHS to bring value. And again, when you look at further at the detail, they're talking about AI in imaging, accelerating detection of disease, supporting the care of patients with multiple long-term conditions. So lots of examples. This is a later example from Addenbrooke's, later than the ones in the Topol review. 30% of patients at Addenbrooke's have prostate cancer, and this is a question about can you use AI scanning systems alongside highly trained staff. So the system takes the scan, it marks up tumours, it reports back to clinicians, and allows a decrease in time needed to spend on processing the scan, increasing the time that can be spent with patients. So the Topol review, really worth a read, and mentioning the two reports. There's this report around preparing the healthcare workforce to deliver the digital future, which looked at 4 questions. How are technological developments likely to change the roles and functions of clinical staff over 20 years? We looked, it was published in February 19, and it looks at underpinning that. The question that's above all this is which technologies, and that's well considered in that report. What does it mean for the skills required? What does that mean for the selection of staff, the curricula they go through education, training and development, all topics that I want you to hold in mind today. There is a companion document which is not so well promoted, which was the mental health engagement, because we saw that so many of the applications coming through were really relevant in mental health. So if you go to the same site and follow it through, you will see that there's a report there on the mental health engagement and reports, and particularly timely now in our current circumstances where mental health care is needing to be carried out remotely. So what does the healthcare workforce need? Topol recommendations, manifold, talks of course about an increased number of knowledge specialists being required. The key principles, there are 3 key principles in the review, but one of these really speaks to our work, so that there will be need for expertise and guidance to evaluate these new technologies. And there's a reference to using processes grounded in real world evidence. And from the panel particularly, some of their recommendations really again touch very closely into the kind of work that we're doing. Knowledge and skills in data provenance, curation, governance. Knowledge and understanding of the ethical considerations in using these technologies, and critical appraisal of digital healthcare technologies. So understanding how it works, of course, but how do you get into the heart of what underlies this and the potential biases? These are all areas where I believe our workforce has a huge contribution to make. And while I'm still on this point, looking at potential bias behind this. I'll just bring to your attention that Deloitte has just published a report called Fast Forward to the Past, and it's asking the question, is automation making our organisations less diverse? Really key question. Do take a look. So with all that said, you know, I'm delighted now to be chairing the CILIP Technology Review, looking at the impact on the knowledge library and information profession of these technologies. We're particularly looking at AI, machine learning, robotics and process automation. What does it mean for our roles and functions? What does it mean for how we prepare ourselves for this extraordinary set of opportunities, and to make sure that we are comfortable and able to interact with our healthcare professionals as they bring these technologies into healthcare, and that we can look how to maximise them in the most positive way within our own services and the products that feed in to our services too. So it's intended as a landmark piece of research to facilitate the development of being ready right now for the digital age we're in, and ready for what it may look like in 10 years' time. So lots of examples. You're going to hear from a great panel of speakers today, which will give you other insights around these, but just 3 examples here of the kinds of things people might say. So we've got a smartphone and a personal assistant. I'm not talking to Alexa in my home, but in the days when I could pop in to see my niece, she definitely is standing in the kitchen talking to Alexa while I'm chopping up vegetables. I don't need to visit a library, just ask it. It tells me everything I need to know. I speak to it every day, and my nephew and niece speak to Alexa all the time. Are collections accessible via AI tools such as Alexa? What does all this mean for openly accessible scholarly information? What does it mean for open access? How are we going to progress that stuff? And then machine perception, machine learning, machine reasoning, language recognition. How are we going to use those to make rich collections more easily discoverable? So an amazing amount of potential. So how do we start to get on top of it? Well, there are already things we can do. We can take part in a MOOC at the University of Manchester. This is one example from a healthcare colleague who's taken this course, found it a really helpful introduction to that programme. And we are obviously holding events like today, and we are looking at developing further courses, and there'll be further information about that next year after the, they'll probably come in after the CILIP Technology review reports, which I expect to be around April. And then there'll be more information from us. So I believe that our core identities and functions will continue, but the nature of our work will shift, as has always been the case as new technologies continue to become embedded. I think the question is really how to position ourselves to be part of that bridge to future ways of working for ourselves and for the healthcare professionals we work with. How can we help them at the very basic end of this keep up to date? And my invitation to you today is to be very curious. Be curious about what we can achieve as we harness AI, and to stay centered, really stay centered on our users, on the people we serve, and on their information needs as we go forward. So I'd like to give you a really warm welcome to all of you today. It's a fabulous programme. I think, you know, one from which we can only learn and be in a much stronger position as we go into 2021. And I'd like to give a warm welcome to all the speakers who are sharing their expertise and experience today. I think it's going to be an inspiring session. Thank you for asking me to open it.